This is the St. Tammany Chamber of Commerce webinar we're having today discussing our COVID-19 vaccines, which on today, the 14th, we're seeing are just now getting started, getting going today. And thanks for joining us. We had a strong response of people who wanted to tune in and watch. We're going to be hearing from Dr. Michael Hill. Also, we have some other guests joining us. We'll be introducing, as well as I see from our registration list, we have a couple of our elected officials also joining us on this registration today. We have Dr. Charles Preston, our coroner, Mayor Greg Comer from Slidell, and it looks like we have Leah Long representing our U.S. Senator John Kennedy also joining us in the call. Through this discussion, a little bit later on, we're going to be letting you guys, of course, throw out some questions. And in the questions, I think it'll be in the Q&A tab. You should be able to type those right in, and we'll be able to get to those global questions later on. But let's get started with our session, our webinar today, like we do every chamber event, recognizing God and country. We have our Rhonda Bagby joining us from Humana. Rhonda, can we hear from you? And you can lead us in a pledge and in a prayer.
Yes, thank you, Tom. Good morning, everyone. I will be leading us through the invocation. If you could please bow your heads. Let us pray. Spirit of wisdom, Creator God, we give you thanks for the many ways you inspire your people, the ways you provide for them and set great paths before them. We are grateful for the many individuals and businesses who are persevering through difficult times. Gracious God, we know that you are the sustainer of our dreams in prosperity and in hardship. We ask that you continue to fill our spirits with hope. Amen. If you could please place your hand over your heart, we will now move into a virtual Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you.
Thank you, Rhonda, again with Humana, helping us out today. We appreciate you. We'd also, before all of our St. Tammany Chamber events, we'd like to hear from our Chamber President, Lacey Osborne. Lacey is going to bring you guys up to date things happening with the Chamber before we get to Dr. Hill. So Lacey, we have you.
Yes, good morning, everyone, and thank you for joining us today. We all weekend we've been hearing breaking news about the vaccine, and it's here, so it's coming. So I'm happy that there's so much interest, and I'm sure we'll get a lot of views since we are recording this as well. We typically, when I give a chamber briefing, I talk about events that are coming up, and sadly, we are not planning any events in person until March 1st. So we will have a virtual annual meeting, and we have not set a date yet. But we are looking forward to a better year in 2021. We have, like many nonprofits and businesses, been impacted by the COVID quarantines and the economic pandemic, but we are looking forward. I want to thank Joan Kaufman with St. Tammany Health System and Rhonda Bagby with Humana on our call today. They have committed to a new package the Chamber is presenting called the President's Level Package. And this is going to be a great opportunity for those that commit to this level. And it's going to tremendously help the Chamber to recover from 2020. So on that note, I also want to give a shout out to all of our members that support the Chamber, and we support you, and we are putting together our statistics on the participation we had in 2020 on the numerous webinars and virtual events that we have hosted and sponsored. As of today, of our 1,100 members, we have 187 members that have renewed their membership, and that's close to $100,000 in renewals. So we look forward to a great year. I want to thank Tom Meyer for his commitment to remain on board as our chairman of the board. And that concludes my briefing.
Lacey, thank you. Yeah, this Chamber of Commerce, we've all been about getting the word out, getting information out, getting out facts. helping our small and our large businesses in this region about ways we can, of course, just develop, market, grow, and stay strong in this weird economy. And of course, as it comes to Christmas, we're encouraging, hey, shop local. Recognize our chamber members and go visit them and shop there, but shop safe. And hopefully, we're getting down to this wrap up period. Hopefully, gosh, through this whole COVID. I personally have had 2 people involved in my life in the past week that have passed away from COVID. This is a horrible, horrible thing. And I hope you are able to stay safe through this thing, get through this thing. And as we wrap it up, hopefully the wrap up, we're getting the facts to you regarding the vaccinations. And that's what today came from, is to hear from you, hear from some experts in our area about what this vaccine can do, answer your questions about them, how we can take things out. And so to lead that, I'll tell you, I'll go right to it. We're going to have Joan Kaufman. Joan, if I'll introduce you. Joan is with St. Tammany Parish Hospital, CEO of the hospital, but tell us more, and then introduce our speaker if you could.
Thank you, Tom, and good morning to everyone. As Tom mentioned, my name is Joan Kaufman, and I am very privileged to serve as president and CEO here at St. Tammany Health System. I also am very honored to serve as an executive committee member on the St. Tammany Chamber of Commerce. And this morning, it truly is my honor to introduce today's presenter, Dr. Michael Hill. He will talk to us about the topic of COVID-19 vaccine and what we need to know. As Tom mentioned, there's a lot of people calling it D-Day. We've got vaccines coming to all of us, and we certainly are preparing for that and excited to be a part of that. Dr. Hill is a native of New Orleanian. He's a graduate of the LSU Medical School, Go Tigers. He has greater than 30 years of experience practicing as an infectious disease physician, and he's seen it all: HIV, Zika, Ebola, anthrax, Legionnaire's disease, H1N1, SARS, MERS, toxic shock, West Nile. That's all I can think of right now. Hopefully we don't see too many more in the future. He's currently the St. Tammany Health System Vice President for Quality and Utilization Management and the Director of our Infection Control. So on behalf of St. Tammany Health System, Dr. Hill is regarded as our own Sanjay Gupta, Dr. Oz, Dr. Deborah Birx, and Dr. Fauci all rolled into one. So please help me extend a warm Louisiana welcome to Dr. Michael Hill.
Thank you, Joan. We'll go ahead. Thanks, everybody. It's my privilege to spend a few minutes with you today talking about the vaccine and where we are and where we're going. So we'll go ahead and get the screen up. Okay, so just going to go through some, there we go, a quick agenda of where we are now. Talk about prevention of viral spread, because although there's a great deal of enthusiasm about what's coming, we got to remember that we've got to stay safe until we all get the vaccine and we get quote unquote herd immunity. We'll talk about immunity after infection. We'll talk about the types of vaccines, spend some time talking about the complications of the natural infection and why we think you should get the vaccine. And then we'll go to sort of the future state of where things are going and what things we think will look like after the vaccine is available to everybody. So I think all of us know, and this is from NOLA.com last week, that the number of patients being hospitalized with coronavirus has gone up significantly. Today at St. Tammany Hospital, we have 39 positive inpatients, and we hit a high last week of in the 40s. That has been the highest we've had since March. So we have seen a significant uptick, and probably due to the Thanksgiving holidays and people getting together. And as you can see, that the coronavirus test positive rate has gone up significantly as well. And that's no surprise. And then nothing's changed as far as the patients most at risk for death are the elderly and those with severe comorbidities, such as COPD, obesity, to some degree hypertension. But something that we've seen a significant shift in the age distribution of people with COVID, and we're seeing a younger population. And for those of people who say, well, this is an older person's disease, we have somebody in our hospital right now, 29 years old. And we're seeing younger and younger folks with complications. So this is not just a disease of the elderly or people with comorbidities. You can see that in St. Tammany, we've seen a significant spike in inpatients. The good part is that we've learned how to really treat this virus and how to treat symptomatic patients, keeping them off the ventilator as much as possible. And we've seen the mortality rate for COVID come down significantly from over 3% to probably about 0.5% now. This is a website that may be useful for you guys if you want to just search the IHME prediction model. This is something that Dr. Burks uses. And Joan talked about Dr. Burks a few minutes ago. I'm trying to streaming her right now. You can go on the website and you can look at the different models. And this has probably changed from when I downloaded this, but it looks like our peak on this surge is probably not going to happen until after Christmas. And this continues to change because this curve has actually flattened out and pushed further back. We initially thought we'd have a higher peak after Thanksgiving and it would peak before Christmas, but now it looks like it's after Christmas. And I would not be surprised if this got pushed out further because of the Christmas families getting together during Christmas. The other thing that we've found out is here in the United States, we're not testing enough. We still don't have enough tests out there. You can see that in places that have low levels of infection, they're testing, for example, New Zealand, 500 tests for every one positive. In the United States, you can see we're much less. So we've got a ways to go to catch up. And I still think testing is going to be quite important as we go forward. So we do have, and I wanted to show this slide because we have a lot of confusion about what's quarantine and what is cleared for procedures. And because there was a change in the CDC recommendations on quarantine. And right now, it's that you can discontinue quarantine at 7 days after you've been exposed if you have no symptoms and you get a negative PCR or antigen test. If you can't get an antigen test, then it's recommended at 10 days if you have no symptoms and no test is done. But to continue monitoring for symptoms all the way through the 14-day period. And if any symptoms develop, then go back into quarantine. Here at St. Tammany Hospital, we're using the hospitalized COVID-19 patients are being delayed for any procedures or anything for 20 days from signs and symptoms. And that's believed because they have a higher viral load and it takes them longer to clear the viral load. For non-hospitalized patients at St. Tammany Health System, we go 10 days from signs and symptoms. And then for asymptomatic patients that test positive, we go from 10 days from the test day. So hope that clears up a little bit because we've had some confusion in the public when they come to the hospital about when it's okay to proceed for elective procedures. Obviously, for an emergent procedure, we're gonna go ahead and take care of you if you need something done right away. So just wanted to talk about herd immunity for a minute because you've heard a lot about that, and we're going to talk about that at the end of the presentation. But herd immunity is that people who are immune or have the vaccine may protect you from getting the virus if they don't get the virus and you come in contact with them. And so we've heard a lot about herd immunity. And one of the places that experimented with herd immunity was Sweden. And for those of you who haven't kept up, the Swedish model failed, and they've actually gone back and said it failed. They had some of the highest death rates in that area. Some of the neighboring countries had 1/10 of the death rate of Sweden. Their economy also went in the tank anyway, so they didn't keep that from happening. So the Swedish model has pretty much been dismissed as a failure. So I just wanted to mention that. The other thing I wanted to say, this is a quote, and actually Joan used this in our morning motivation last Monday, that this is not the end. This is not even the beginning of the end. Perhaps it's just the end of the beginning. So even though there's a lot of enthusiasm about vaccines, we have a ways to go before we get the population immunized and get to the point where we get back to normal. So a few things. Do you develop immunity after infection? I'll try to answer that. How long does the immunity last? What is the percentage of the infection that has to happen in the population so that we can achieve herd immunity if we were going to do it through natural events? And finally, does the virus mutate to negate herd immunity? These are all questions that we get quite often. I'm just going to kind of go through that. This is a slide that shows seroreversion. That is, once you get infected and you have antibodies, when you revert to negative on measuring neutralizing antibodies. And it turns out that those people that have asymptomatic infections or very light infections and aren't very symptomatic have a very low antibody response. And so they serorevert to negative. You can see that very long graph that shows how that over 65% seroconvert to negative. That doesn't mean they don't have immunity. That means you can't measure neutralizing antibodies after a time in these patients. However, those with high antibody responses, the sickest of the patients, don't serorevert as quickly. So just it's apples and oranges when you're comparing patients who have a severe infection compared to those that have a light or asymptomatic infection. And we believe this is probably the case for children as well, that they don't hold on to those neutralizing antibodies as long as those that have a severe infection. Again, there's a second part of the immune system I'm going to talk about in a few minutes that is beyond neutralizing antibodies that will probably give us some protection against the virus and give us memory in our immune system to fight the virus if we get in contact with it. So we want to just go over herd immunity and what we saw from 1918. Sometimes you have to look back to figure out what's going to happen going forward. First of all, herd immunity curbs pandemics, but it doesn't eradicate them. The virus, the 1918 virus, the H1N1 virus, still persists to this day. And we had a huge outbreak in 2009, which really tragically infected a lot of young folks that didn't have any antibodies from the past, and they had some of the highest mortality rates. And 2 years after the start of the 1918 pandemic, there were over 5 million infections, 500 million infections, and 50 million deaths worldwide. So it was pretty dramatic and tragic. So the COVID-19 spread is estimated to be an R naught or RT of 2 to 3.2. What does that mean? That means for every one person infected, you're likely to give 2 up to 3 people the infection, and then it'll continue to carry on exponentially. For us to stop this naturally, we would need 50 to 70% of the world's population to be immune. And it's really the world's population because people travel. That's how the virus got to us. So if we imagine that 60% of the population would need to be immune for herd immunity, we need 198 million people to become infected and develop antibodies. So if we do the Swedish model and we assume a very conservative 0.5% fatality rate, it would require 1 million deaths in this country. I don't think any of us think that's worth getting herd immunity without a vaccine. And only 10 to 12% of the US population so far has been infected. That number is climbing, but we certainly don't want to see herd immunity occur on the backs of 1 million people who die from this. So the prevention of viral spread really is about a lot of different things. Some of it is personal responsibilities, and I'm not going to make any political statements about masks or anything else, but I think it's important that we all do our part to prevent this virus from spreading. And I think masks are important. I think hand hygiene and social distancing are important. And I stand by that scientifically, and I don't apologize for it. And again, this is not political. This is good epidemiology. And you really need to limit our crowds. We should not have super spreader events. That doesn't make any sense. And then I think testing and tracking is important, although that's very difficult. I think ventilation, being outdoors in the air, is important. UV light kills the virus. I think there's going to be a need for quarantine, obviously, and isolation, and then finally vaccines. But you can see it's going to require a lot of different things for us to get where we need to be so we can get this economy up and going again. And look, I'm as sick as anybody about this situation. And we've got a lot of tired people at the hospital, but they're continuing to work hard. And the thing that's a little bit disheartening is when you see people in the public saying, look, it's my right not to wear a mask, or I should be able to go to super spreader events. And to Tom's point, just come to the hospital and find somebody who's really sick. It'll break your heart and it'll make you realize this is not something we should be taking lightly or being cavalier about. So wearing a mask does reduce the severity of disease. It does reduce viral shedding out into the atmosphere. There's a good animal model that did show, and I don't know how you put a mask on a hamster, but we did show how we kept, this study did show that hamsters do, when masked properly, did not spread the virus to other hamsters. So there's a good animal model. And we know also in case series that people on cruise ships, food plants, and in hospitals, that there was an increase in asymptomatic cases, but a much lower increase in symptomatic cases. And we think that wearing a mask, even if the virus is transmitted, you get a much lower viral load and you have a much decrease in symptoms. So we do know that, and I'm going to show you in a minute, there is a decrease in population infection rates and subsequently deaths in patients in populations that wear masks. This is a good example. This was in Kansas, where some of the rural places held off on mask mandates in counties, whereas some of the urban centers that saw a very early spike in COVID cases did a mask mandate. These counties did, and the number of cases leveled off, whereas in the rural cases that were late to come to a mask mandate had a significant spike over the same period of time. And this was in just this past October. There's also an interesting study, and the CDC has really touted this, on a hair salon where two of the hairstylists became infected with COVID-19 and spent at least 15 minutes right next to people with 139 clients. But they wore a mask the whole time, and none of their clients became infected, which was pretty significant because this is a very infectious virus. We often get a lot of questions about what are the best masks, and the N95 mask or the KN95 mask are the best. Obviously, if you can have a fitted mask where there's no leak around the sides of the mask, that's even better, and we do that at the hospital. But if you can get your hands on an N95 mask, it's pretty good. The problem with N95 masks, frankly, are difficult to breathe, especially if you're on an airplane for several hours. Good luck. But surgical masks turns out almost just as good. And we now know that double cloth masks work well as also. The fleece mask, as you can see all the way on the right, is one of the worst, and obviously it may even facilitate spread. So if you're trying to get on a Southwest flight with a fleece mask, they will hand you a different mask before you get on the plane. So as you can see, the mask that you wear will prevent somebody else from getting infected. There also has been the efficacy of mask mandates really have shown that and again, I'm really for people taking their own responsibility. That's what we're all about. But places that had mandatory mask mandates had decreased cases of COVID per 1 million. So it just shows you the more stringent and the more compliant the population is, the lower the risk of spread. And finally, it really is also the power of social distancing. If you can see with an RT or R naught of 2 to 3, that for every one person infected, if you don't wear a mask, 2.5 people are going to get infected within 5 days. And that's going to exponentially increase over 30 days to over 406 people infected. Whereas if you have 50% less exposure, only 1.25 people being infected, you're all going to see an increase, but much less, only 15 people as compared to 406 people within 30 days. And then if you have 75% less exposure and you have an RT of less than 1, you're actually going to see a diminution in cases down to 2.5 people infected mathematically over 30 days. So significant decrease with social distancing and wearing masks, hand washing, etc. So I'm going to talk a little bit about COVID-19 vaccines. This has stirred up a lot of passion, and obviously we're making the vaccines to our healthcare workers. It's not mandatory. It is by everybody's discretion. But I think when you look at the risk benefit, most people are going to want to take the vaccine. And this lady became very famous. This was the shot heard around the world, right? She was 90 years old. Miss Keenan got her shot last week in the UK, where they got the Pfizer vaccine. And she's going to be 91 this week, and she said she's looking forward to seeing her children and grandchildren. So wonderful story there. And thanks for her for allowing that. I want to talk about the 3 phases of vaccine development. And there we go. Perfect. So phase 1, you'll hear about this, but I just want to explain what the different phases are. So you know that these vaccines, by the way, the technology for the mRNA vaccines, which I'm going to talk about, have been used for over 12 years. So this is not something that was developed in the back of somebody's garage for the last 6 months. This has really been good science. So phase 1, and when you hear about that, the vaccine is given to healthy, brave adult volunteers, and it helps science understand if number 1, the vaccine is safe, if it seems to work, if there are any deleterious side effects, and the size of the dose. So that's sort of phase 1. It's an unblinded study. You're giving the vaccine to everybody. Phase 2 is much larger, and this is the time when we start seeing the short-term side effects and how volunteers' immune systems respond to the vaccine. And then phase 3, which we're in right now for many of these vaccines, but and more will be coming forward. We compare people who get the vaccine versus people that don't get the vaccine, and that's the double-blind study you hear about. So some people get saline, and some people get the vaccine. In some studies, it's 2 people getting the vaccine for every 1 getting saline. But we look at the longitudinal progression of disease or not in patients who receive the vaccine versus those that don't. We also look at the safety of the vaccine. So what's happened is Pfizer and Moderna are now reaching numbers that are significant to statistically determine that, number 1, these vaccines are effective, that less people get symptomatic infections when they take the vaccine versus those that don't in the study. And second of all, that the vaccines are safe. There have been a couple of times where I know that we've all heard where vaccine trials were halted. There was a couple of neurological conditions that were talked about, but for the most part, the vaccine was very safe. All these vaccine trials that are now coming out looked very, very good. So these are some FAQs on COVID-19 vaccines. First of all, and this is something that and really there's no crazy question when it comes to these vaccines because it's new science. So we have to make sure we get the facts straight. Number 1, COVID-19 vaccines will not give you COVID-19 infection. The side effects from the vaccine are anywhere from sight soreness to muscle aches, fatigue, and fever. It's more common with the second dose than the first dose because your immune system is revved up. And the things that we get, these symptoms that we get are the result of your immune system. So when you're going through this, and it usually lasts about a day, realize this is showing us that your immune system's functioning and you're developing immunity to the virus. COVID-19 vaccines will not cause you to test positive on COVID-19 viral test. People vaccinated may test positive on some of the antibody tests because you're making antibodies against the spike protein. people who've gotten sick with COVID-19 still might benefit from getting vaccinated because, as I'll show you later, you get a very robust immune response, and maybe better than you would from having a mild case of the virus. Getting vaccinated can help prevent getting sick with COVID-19. And we know that there's a pretty good durability of antibody response for over 90 days. And as the studies go on, we'll have more information at 180 and 270 days, et cetera. This is a big one. Receiving a messenger RNA vaccine will not alter your DNA or RNA. We're not doing GMO tests on humans. The mRNA does not enter the nucleus of your cell. It does go away after a very short period of time, so it doesn't linger around. The other thing is you can't mix vaccines. If you start with the Pfizer vaccine, you got to end with the Pfizer vaccine. You can't get a Pfizer vaccine and then a Moderna vaccine because we don't know if they're going to work that way. However, if you accidentally get a second mixed vaccine, that's the end of your vaccine, and we'll measure the antibodies later on. There are limited studies in children and in pregnancy. However, on a call we were on yesterday with CDC, it is highly recommended for pregnant or nursing females to get the vaccine if they're in high-risk situations. That is, if they're in healthcare or working at a nursing home, et cetera. So far, although we have limited data, we think this vaccine is very safe in pregnancy. So there are probably now over 200 vaccines being developed. Most of these are never going to come to market, but we're going to see a lot more vaccines. These vaccines are either an inactivated or weakened virus. Some of them use a viral piece to produce immunity. Some of them produce viral units that can't infect you. And then the nucleic acid ones are RNA and DNA, the genetic material. So I just went through some confusing things, but we'll walk through this kind of slowly and talk about the vaccines in just a minute. So what happens when you get, you're exposed to COVID and you get an infection? First of all, you're going to see, if you measure, the viral RNA is going to go up because it's reproducing, and you can measure the viral RNA. The viral antigens, which are the proteins on the outside of the virus, go up very high while you're sick. And then as the virus goes away, it doesn't last forever. And by the way, it's not the virus that causes the issue. It's your immune response or over response to the virus that causes people to get very sick. I know that's semantics, but that's kind of the way that works. So after you get the virus, IgM antibodies occur first. So those are the early antibodies. And they occur from about week 2 through maybe week 6, and then you start going down after that. But at the same time, IgG, these are the two neutralizing antibodies, IgM and IgG, increase and stay high. And what we're going to be doing is measuring these antibodies as we go forward, and that's what we want to see. We want to see those neutralizing antibodies stick around from a natural infection or from a vaccine. There's a recent study in New England Journal to show that even after 90 days after the second vaccine, regardless of age, the antibody levels stay very high. So that's a good study, and that's a good start to showing that the vaccine will produce durability. And then if you want to know about protective antibodies after COVID-19 infection, and I think we can kind of say the vaccine may do the same thing, there are a couple of just 3 epidemiology studies that were naturally occurring that showed that if you had neutralizing antibodies, it protected you from getting sick. One was a fishing ship that occurred where 3 people with protective antibodies did not get sick, and 104 out of 122 seronegative patients converted to positive on repeat testing. And some of them had asymptomatic infections, but many of them were sick. There was an overnight summer camp outbreak. 16 out of 152 patients with prior antibody, people with prior antibodies did not get sick. And it turns out with subsequent studies, 80% of the seronegative people tested positive after exposure. So you can see this is a pretty, this virus is very infective. And then there's some healthcare worker studies that showed immunity at 6 months and neutralizing antibodies persist. And in this longitudinal study, out of 12,000 patients tested, 1,200 had positive IgG antibodies that we talked about to the spike protein or nucleocapsid antigen. 79 converted during a follow-up, but in the 89 people that had confirmed symptomatic infections occurred in seronegative individuals. And in asymptomatic infection, 76 occurred in the seronegative, the people who never had the prior infection, and only 3 in the seropositive patients, so those 1,200 patients. So it goes to show you that at least for these 3 studies, the durability for infection, for immunity is pretty good, and protection from having a severe infection, if any infection at all, from a secondary exposure. So let's just talk about the hot topic right now, the nucleic acid vaccines. This is really scientific breakthrough of major proportions. These vaccines are easy to develop. They're made of genetic material only. You basically get the immune system to look at this as if you've had the virus without you having the virus, and you produce really strong antibody response. And it really is all about the spike protein that you're making antibodies again. And it turns out that the mutation rates of the spike protein are very, very low. So it makes you have immunity, and we don't think these coronaviruses are going to mutate out of the effectiveness of the virus. And then there are transport and storage challenges. The mRNA has to be transported in a very cold environment at minus 70 degrees centigrade. Once you get the vaccine delivered, you can keep it in the refrigerator for up to 5 days. Once you open the vial, you got 6 hours to use the 5 vaccines that are in each vial that are available. So you can see there's some challenges. I had to throw this one slide up just to show you that, yep, this is complicated stuff. But basically, look at that RNA. It's made in a lipid covering so that it'll enter the cell. It stays in the cytoplasm of the cell, does not get into the nucleus. It transcribes and causes spike proteins to be produced. This presents to the immune system, and the immune system revs up and makes neutralizing antibodies to the virus, and that's what we want. So it turns out that not only does it do that, but it also tweaks T cells, T memory cells, to remember that you've had the virus, so that if you get exposed again, those T memory cells can start the immune system up very quickly. There are going to be other vaccines, and I wanted to just spend a couple of minutes on that, and then we'll finish up. One is the Johnson & Johnson adenoviral vector, which actually uses a chimpanzee adenovirus that won't infect human cells to carry genetic material into the cell and again produce spike protein. Does pretty much the same thing to the immune system I just showed you, and we think this will be released sometime in the first quarter of next year. The nice part about this vaccine is it's easier to transport, and they're doing the study with only 1 vaccine instead of the 2 vaccines that are required for Moderna or Pfizer. And then AstraZeneca is working on the same thing, but they're looking at 2 doses. The AstraZeneca vaccine has had a little bit more challenge in that they've looked at a full dose versus a half dose for the first dose. And there's some question about the methodology on this, but it seems to be a very effective vaccine. So at St. Tammany Health System, we're going to get the vaccine. The state distributes vaccine based on population. Pfizer and Moderna vaccines are going to be first. They both require 2 doses. Pfizer at 21 days apart, and the Moderna vaccine at 28 days. There is prioritization at this point. Right now, we're going to give it to the folks that are doing direct patient care and contact. Physicians, nurses, respiratory therapists, environmental services folks, and others that have to get into the room. We're going to stagger the vaccines because we do expect there'll be some side effects, maybe for a day. So some people may have to stay out for a day. But we think that, so we're not going to give it to everybody on one shift. We're going to stagger it. And our employee health services, and those of you know Leslie Kelch, she's gung-ho on this and she's ready to roll. The Louisiana vaccine rollout phases, for those of you who ask, well, what about me, or what about, how is this going to work? As we get more vaccine, and I think we'll have a lot of vaccine in the spring, they're going to go first for healthcare, and that includes nursing homes and adult residential facilities, not just the patients, but the workers, because we know from the last spikes that the workers came in with asymptomatic infection, unbeknownst to them, and unfortunately gave it to the personnel. So nursing homes are going to be important, adult residential cases. And then phase 1B, we've got to get to the first responders. We've got to get to the state and federal response personnel, public transit, pharmacists, food processing, people 65 and older, since that's the most vulnerable population. And then we'll move into phase 2, which will involve K-12, grocers, food producers, et cetera. You can see there. And then phase 3 will be the general public. And the timeline is really going to depend on how fast these vaccines become available. So just want to end up, why do you want the vaccine and not get the natural infection? Well, it's sort of like playing Russian roulette with the natural infection, because post-COVID-19 syndrome is a real thing, and you don't know who's going to get this and who won't. And you don't want to be any of these pictures in these pictures. And this is called the COVID long haulers. And these people don't know when one of their symptoms are going to go away. And some of it occurs in young folks. It's not just an age-dependent malady. And you can see the symptoms that occur can be anything from fatigue to shortness of breath, to cough, joint pain, a loss of taste or smell that doesn't come back, memory and concentration issues, hair loss, COVID toes, something called postural orthostatic tachycardic syndrome, or POTS, which is a issue with the nervous system. And these people stand up, they get tachycardic, faint, and really can't do anything. And it's a very debilitating disease. That's about 1% of the patients who get COVID that are hospitalized. And it occurs more frequently in women. And it's really a very debilitating disease and of much concern. So that's why you really don't want the natural infection. This will not occur. These things will not occur, as far as we know, with the vaccine. So finally, what do we see for how will the pandemic end? I do think it's going to be important to stress to the public that we're going to need to keep doing masks for a while, that just because the vaccine's been released doesn't mean hallelujah, all is over. We've got to continue to be careful. It's going to take time. Once critical mass is vaccinated, we may need to have proof of vaccines for various venues, such as traveling on airplanes or going into certain events. We've got to vaccinate the world, because if we don't, this could be reintroduced into society again. And we don't know how long the vaccine will provide protection. And we think there could be sporadic outbreaks in the future. Will we need yearly vaccines? Nobody knows. We do know there'll be a subset of people who unfortunately are going to have long-lasting effects from the virus that we talked about. I think social and business norms will be different. I know here at St. Tammany Health System, we do a lot more televisits. I never thought we'd see the number of televisits, right, Joan, that we see now. It's just incredible. More people will be working from home. There may be less business travel in the future. Nobody knows how that's going to work out. We know that people near retirement, we've had a couple of physicians and some nurses that have actually left the workforce because they're worried about getting infected, their own health and the health of their family. And I think the other thing we need to do as healthcare, government officials and others and leaders, we need to heed the lessons that we've learned for the next pandemic. And I'll just share this. All the hospitals and healthcare systems kind of had real-time personal protective equipment. We're not doing that anymore. We've got significant storage now of those things. We need to have more of this manufactured in the United States, so we're not dependent on foreign governments for getting our personal protective equipment. It was a real problem at the beginning of this pandemic, and we never want to be in that position again. So with that, I'll stop and answer any questions. And thank you all very much for your attention.
Dr. Hill, thank you. That was, well, that was a lot. You covered very quickly. A lot of information there, a lot of facts. And some people are asking, will we have this presentation available? Yeah, we're going to have it. We are recording, and your presentation slides will also be available with the recording as well. Because I know some people also were just joining us maybe by phone, but we will have these presentation slides available. A few questions came in advance, and I know you covered a lot of this, but so maybe repeating it. But one of the ones was you mentioned how the different companies. How do you know which company you're actually getting, which vaccine you're getting? And I know it has to stay very, very cold, is what we're reading as well. And how do you know it's actually staying cold? So, yeah, as you mentioned, you have to have 21 days apart with one, 28 days apart with the other. How do you know which one you even actually get?
Sure. Great question. So when you get the vaccine, you're going to get a fact sheet handed to you. It's going to tell you exactly what vaccine you got and when you need to follow up. And it'll answer all the questions, some of the things that I went through earlier with FAQs. Um, so you will know when you get the vaccine. There is a very stringent sort of chain of custody of the vaccine. So we have to know exactly when the vaccine got thawed, how long it's been in the refrigerator. There are very strict quality controls on these vaccines. And CVS and Walgreens are going to be doing a lot of the immunizations for the public. They've gone through this. And UPS and FedEx, everybody else is geared up. I mean, these planes, I don't know if you saw the pictures in the news, had super cold freezers built into the planes that were transporting these things. And then the trucks the same way. I don't know if you all saw the trucks were actually under armed guard to prevent people from, taking the vaccines from the trucks. So it's been very Operation Warp Speed has been very well thought out. And the military is involved, and when the military is involved, you get it very precise. So I'm very confident that this is going to be carried out. Is it going to be a oops every once in a while when you're giving out a lot of vaccines? Absolutely, but I think it's very, very it'll be a rare example if that occurs.
What about people who are having other injections, like allergy injections or other things they're taking, even the flu injection? Should there be a timeline or a wait between those injections and the vaccine injection?
Great question. If you wouldn't have asked it, I probably would have asked it myself. 2 weeks. So the CDC recommends 2 weeks from any vaccination or allergy shots. Anything that affects the immune system, you need to wait 2 weeks to allow your immune system to recover so that you'll be ready for the vaccine.
Okay. And you mentioned, I think also, it's like after you get the vaccine, it doesn't mean don't wear your mask anymore and go out and have your parties. It means you're still going to have to protect yourself even after you've got it.
Absolutely, and two reasons. First of all, the first vaccine we know is probably about 50% effective. So don't realize you've got to get that second vaccine. Second thing is we don't know at this point. I was on a CDC call yesterday, and they stressed this that folks that get the vaccine still might potentially get an asymptomatic infection and be a carrier, not even know it, and give it to somebody else who's not vaccinated. We don't know that right now. So it's still going to be important. You're probably protected from getting sick from COVID, but you're not protected from perhaps being a carrier and give it to somebody else. So that's yet to be resolved.
Some other questions that came in from Victoria. Will the vaccine be recommended for children soon? And is there a greater period of delay for approval of vaccine for children?
Yeah, great question. Yes, it's going to be a delay. There was some controversy when the advisory council for immunizations suggested that the vaccine go down to age 16 years. Actually, a couple of people on that panel voted against it because of that recommendation. We do know that the vaccine's been studied extensively in people 18 and older. They've done more now in 16 to 18. And currently they're now enrolling from 12 to 16. And then we'll get down to the younger population. We think that the younger population, as you know, especially kids under the age of 12, most of them have very mild asymptomatic infections. And if we get the adults immunized and protected, we may develop some herd immunity among the adult population, and the pediatric population will be less intense. But we certainly want to make sure for immunocompromised pediatric patients, we have a vaccine. That's going to be really important, but it's probably going to be a few months out. And I don't have a good timeline on that yet, but they think by probably March or April of next year, we'll have a pediatric recommendation and a vaccine available.
Okay, thank you. Someone writes, after the second shot, how long can you safely expect immunity?
Usually we think the immune system or that IgG level peaks at about 4 weeks after immunity. So it does after, the second injection. So it's very important not to think that after you got that second injection, you're immediately immune. It does take time.
Okay. Someone else asked you in a presentation, what are COVID toes?
Oh, it didn't, I had a little picture of it. Swollen, red, tender toes that people get, and it was a dermatologic condition that people started recognizing after COVID outbreak. It's very painful. It does go away most of the time. Unfortunately, before it goes away, you might lose a toenail or two and lose some skin around the toes, but it's really a pretty debilitating disease when you have it, because it can be quite painful. Reason why it's important, and you can Google the image and see what the pictures look like, is to recognize it. Because if you see that, you think, oh my goodness, I better go get my antibodies checked. I had COVID.
Okay. I think you kind of covered this earlier, but because someone says, does the vaccine cause any kind of sterilization or problems with getting pregnant in the future?
No, there was some fake vaccine news that went around by anti-vaxxers. Let me say a couple things. These vaccines were not made with fetal tissue. They weren't. So it has nothing to do with aborted fetuses or placentas or anything like that. That's very important to know. And the second thing is, this does not cause sterilization, because I did see some fake news going around about that, and that's just pure fake news. So
Okay.
I'm glad somebody asked the question, because you're going to get a lot of stuff being pumped out by anti-vaxxers that aren't true about these vaccines.
Someone asked, their frequent blood donor, is there a certain amount of time they should wait after vaccination before donating again?
That's a great question. I would say, although the blood center hasn't released anything I've seen, and if anybody knows, please let me know. I think that they'd want you to wait at least probably 2 and more likely 4 weeks before you go back and do a blood donation. Again, you can't spread the virus, and they do antibodies test on you anyway. But I have a feeling they'll probably wait a little grace period between when you get the vaccine and when you donate. And it might be also for health reasons, just not to put you under a stress in giving blood. But I would wait for direction from the blood center on that.
Right. Someone asked, given the frontline coverage provided by food banks and pantries typically are by volunteers who are early retirees, what phase do you see maybe these workers being placed?
I think they're probably going to be in 1B. I think the second line. I think we're talking about the same thing in volunteers everywhere, even in healthcare, our own volunteers. At some point, we're going to have to consider when they get vaccinated. I think that's going to be important.
Okay.
When you're doing a public facing event and you have a lot of contact. So.
Okay. I think you got to cover this earlier, because as an unknown question, I'll ask it again. Will the vaccine be like an annual flu shot, or is this a one and done?
Oh, we don't know.
Yeah.
I hope it's a one and done. I hope we don't have to do this every year. But only time is going to tell us whether or not you need a booster effect from this vaccine. At this point, there's no plans to do a booster, but of course, time is going to tell going forward. But great question.
Good. And I'll kind of add to this question here. Vaccinations which are being provided to the general public, how do you see those being provided? I know you mentioned a couple of pharmacies, but is it also going to be maybe your local physician that you go to as well? Do you go to the hospitals and get it done?
It's going to be local physicians. Some of them will have access to the vaccine. I know we're planning at some point when we get the okay and we get the distribution, that we're hoping we can give the vaccines in our clinics as well. I think that will be very convenient for people not to have to go to the doctor and then to the pharmacy to get the vaccine. But I think just logistically, with the number of people who are going to need vaccinations, you're going to need everybody to be given the vaccine. So given the widespread distribution of CVSs and Walgreens, even in rural communities, we're going to need their help as well. But I do think it'll be available in the clinic. It'll be clinic by clinic decision. I think once the vaccine's available for children, it'll be available in pediatric offices as well.
Great. Someone asked, do you have a source or a good website information maybe to pass on to people who are anti-vaxxers or anti-maskers or doubters in general?
Yeah, CDC website's the best. You can go to emergency.cdc.gov and you'll get a whole list of websites of all the things that the CDC publishes on data about mask wearing. In these slides, I have some references on those studies I showed you. But those are the best sites. And if you want, actually in about 2 minutes, you can go to the website I just gave you and do /COCA, and you can see the CDC presentation on the vaccine to clinicians. So the CDC is going to be having routine presentations for clinicians that will be on as data changes. I tell everybody all the time, Joan's heard me say this numerous times, and Aaron too, what we say today is going to be very different when we may say a month from now, because we'll know more, right? And I think we'll definitely know more about the vaccine. For those people that get the vaccine, it's recommended that you be observed for 15 minutes after the vaccine to make sure there's no allergic reaction. The most common side effect, I have to say, is the injection site tenderness. So just FYI, you're probably going to be a little sore where you got the vaccine.
Well, Dr. Hill, thank you very much. That pretty much answers all of our questions coming in, and we're right on time to our promised time to have you today. Anything closing you want to add from you or from Joan?
First of all, I want to thank Joan and for all of her support. She's done a wonderful job. I think that it's been great being able to talk to you, and I appreciate the ability to talk to the chamber today. And I want to appreciate all the hard work everybody's done in the community. It's really been a tough time. And I'd say this is the time to double down on protection and let's not give up. There is a ray of sunshine at the end of the tunnel. We just got to get through this and do the right thing till we get everybody vaccinated. So good public safety measure is the big thing I just want to emphasize.
Very good. Well, Dr. Hill, thank you very much. We do hope we get through this thing very quickly. It's going to be tough, I know, even with the Christmas holidays and Christmas time coming up for people in Hanukkah, just spending time with each other. But hopefully they're able to protect themselves, socially distance, and just be a very different time. And the whole purpose is to be able to do it again next year to celebrate. Take care of yourself, protect yourself, social distance and be wise. So thank you very much for your input.
Thank you.
All right, guys. Again, this concludes our discussion today about the COVID-19 vaccine brought to you by the St. Tammany Chamber of Commerce and our friends at St. Tammany Parish Hospital with Dr. Hill. Thank you, everybody. Be safe. Hope to talk to you soon.